I'm joined by John Steenhuisen to discuss this and more. John, before we get into the meat of what you want the debate to be about, you've just heard the Deputy Director General of the Department of Health being very defensive, saying there are no delays. They've had all the conversations that they could have had, and they've done the best that they could to get the vaccine. Do you believe that's true?
Well, that reaction that we've seen and witnessed, and which has been broadcast, hardly builds confidence in government's response. It seems very panicked, very defensive, and looking for scapegoats rather than confronting the real issue facing us headlong. And that is, why do countries like Argentina, Chile, Costa Rica, as well as the entire European Union, have started a vaccination program weeks ago, and we're only going to get vaccines in the second quarter of next year. And even then, it's just 10%. These are a significant ball has been dropped here. And I think the defensiveness that you're seeing from those particular officials is precisely as a result of the fact that they know that the South African public are onto them now, that the media are onto them, and that they've got some serious questions to answer.
Do you think that there was a lack of due diligence when we were shopping around for a vaccine, going straight to COVAX and not looking around for all the options that we could have had from the beginning instead of scrambling now?
I think that, look, I mean, I think where I do agree is that hindsight is a lot clearer than what's going on in front of you. But that means that once you drop the ball, you've got to find the best way to pick it up. Look, COVAX itself is in receipt of an internal report from Gavi, which is a vaccine alliance, which points to serious concerns around the effectiveness of COVAX and whether it will be successful. That report was tabled and discussed internally with COVAX, and it points to all of the problems which we're starting to see manifest themselves here. I think that what South Africa should have been doing, and what we can still do, if we really want to address this issue, is to start dealing directly with the manufacturers as all of these other countries. And these are not wealthy countries. Costa Rica is not a wealthy country. Argentina is notionally bankrupt. But they've put their money where their mouth is. They've gone directly to the suppliers, and they've secured the vaccines. AstraZeneca has now been approved in the United Kingdom. It seems good for our conditions. It just requires normal refrigeration, and we can roll it out. But it comes down to priorities, and I think that's where government does have a case to answer. While we were fiddling around with bans on tobacco and alcohol and cooked chickens and telling South Africans what they could wear and how they must wear it, other countries were getting serious about looking for vaccines, and most importantly, because the vaccine on its own is not good enough, you need to have a rollout plan to be able to make sure that you can get that out there effectively. And previous immunization programs on polio, measles, and others shows that this is a big logistical exercise. And I think that what we need to see from our government is say which vaccine has been approved, when we're going to receive it, how many doses we're going to receive it. But then let's also, if fighting COVID is now our #1 priority, and certainly that's the impression I got from the president's address, then let's put our money where our mouth is. It's going to cost $2 billion to get the vaccine into South Africa for the 10%. We're about to spend 10 billion rand on South African Airways. Surely, if there's a priority, it's got to be the health and welfare of our people. Let's rather use that bailout to procure more stocks of the vaccine, and let's start being creative and going directly to suppliers. They're businesses. They're looking for customers. They don't get caught up in the niceties. You pay a deposit, you place the order, it gets delivered, you pay the balance. That's how business works. These are all business companies. They're not NGOs. And I think that if we are serious about it, we want to take this thing forward as quickly as possible, we've got to start being a lot more creative than it appears the deputy director who was on that interview is.
Right. I mean, the deputy director is explaining that, look, they are approaching suppliers and manufacturers, and they're simply saying, look, there's no stock, you're just going to have to wait. And that's what I want you to get into here. With this debate that you want to happen before the new year, What comprehensive plan would the DA put forward for this vaccine? And please indulge us on your rollout plan that you would include here as well. And then also what I've just mentioned now, if people are saying, look, we don't have stock, then where would you go as the DA? How would you remedy the situation?
Well, I'm not sure that that out-of-stock story is exactly true, and that obviously needs to be tested. But I would say simply this, that if there is a lack of stock, it's because we're right at the back of the queue because government's dropped the ball. But I would certainly be approaching, well, first of all, you need to get the money on the table. Let's cancel the bailout to South African Airways. Let's cancel the bailout to Denel. Let's cancel the bailout to Alex Call. Let's put that pot of money on the table. And let's go to Pfizer, Moderna, Sputnik, Sinopharm, AstraZeneca now, and say, we would like to secure the vaccine directly from you. What is the best way for us to go around doing that? Once we can get confirmation that it can come in, let's get a date, hopefully sooner than April next year, for the rollout. You're going to then have to have a plan about who gets this vaccine first. Who are the first people that get it? Our rollout plan would start with frontline healthcare workers, nurses, doctors. It would then move on to teachers and the education sector, because these are two sectors that have been very badly affected by COVID-19. We would then move on to a general vaccination program on a province-by-province basis using primary healthcare facilities and hospital facilities and all these mobile clinics that we have to get out into communities and provide the vaccine to those who would like to have access to it. That's also going to require funding. So what we have here, I believe, is a lack of urgency from the funding perspective. Government had to go to the Solidarity Fund for the 327 million rand deposit, which is why there was those two timelines that were missed. Government didn't appear to have the money. So let's find the money. That's where you've got to start. That's the genesis of solving the problem. Find the money and have the rollout plan moving out thereafter.
Right. And just a final, briefly, have you heard from the Office of the Speaker in terms of your request?
Yes, breaking news. You're the first to know it. The Speaker has denied the request for us to have a debate. It's nothing new. We've had a number of debates that we've wanted in the past. And I think Parliament's letting the side down. I think that one of Parliament's jobs is to hold government accountable. And I think it would be good to have the Health Minister or the President, whoever they would like, to come to Parliament and tell the nation's elected leaders what the plan is, because we've got to tell the citizens out there something. We can't just simply sit on our hands, sit quietly in a corner and wait, hopefully in April next year, that 10% of the vaccines will arrive. This is like a wartime situation. You've got to marshal every one of your resources towards achieving your objective. And that is making sure that we keep South Africans safe, that we can return to some form of normality, whatever the new normal is, and that we can keep our economy moving, because government relies on taxation on the economic activity in the country to fund the public health care response. If we kill the economy, we actually have a knock-on effect on the public health care response. So let's treat this like a wartime situation. Let's all come together. Let's put our heads together and say, what are we going to do now? We solve the problem. The ball's been dropped. We accept that. But how do we move forward now to get this vaccine as quickly as possible and to as many South Africans as possible?
Many thanks for your time. That's DA leader John Steenhuisen saying that the DA's request has been denied by the Speaker of Parliament, and so that lack of transparency that's been complained about by so many organisations continues until they can get together and government account for the vaccine issue.